All right, thank you, Dr. Kraft. All right, so let's start with an overview of the topics that we will cover today. So first, we will try to understand the biological changes inside the brain after an injury. Then we want to introduce different types of attention difficulties that one may experience after a brain injury. We want to go over the external and internal strategies that will address attentional inefficiencies. And then towards the second half of the webinar, we want to shift gears to talk about slowed processing speed, which is a fairly common cognitive complaint after brain injuries. And then we want to share a strategy called time pressure management to address slowed thinking speed. And then we will wrap up with a Q&A session. All right, so what is an acquired brain injury? It is essentially defined as an injury to the brain that is not hereditary, congenital, degenerative, or induced by birth trauma. The injury results in a change in neuronal activity, which can affect the physical and the metabolic activity and also the functional ability of nerve cells in the brain. So if you look at this diagram, there are two types of brain injuries. On the left is something we call non-traumatic brain injury, which are often caused by internal factors. So some examples can include stroke, which is a top leading cause of acquired brain injuries, lack of oxygen, intoxication, virus inflammation, infection, or maybe perhaps like a tumor pressing on brain tissues that would affect internal structure. It can also come in the form of a TBI, which is often caused by external factors. So examples would include experiencing a fall, being in a vehicle accident, struck by foreign objects, or being exposed to explosions as well. Now, according to the National Center of Health Statistics, acquired brain trauma is the second most prevalent disability in the US, which is estimated to be affecting 13 million Americans. And according to the CDC, there is an estimated 2.5 million people that sustain a TBI annually. When we look at the data, though, from clinical science, research does tell us that early intervention and management of mild TBI symptoms is the most effective means of reducing the level of disability experienced by the injured person. And here we also want to highlight that no two brain injuries are exactly the same. The effects are very complex and they may vary from person to person. So it is very important that you work with a therapist who understands the etiology of your injuries and their assessment and use that to inform your individualized rehab plan. So we always have clients ask like what exactly happened to the brain after an injury or during the injury actually, and which leads to cognitive changes. Now, there is a range of physiological damages, and we tend to look at injuries on a primary and secondary level. So primary means immediately after the injury, where there could be bleeding, twisting, and sharing of brain tissue. So if you look at this picture here down below, you can see that there are so many different forces that might be tearing the axon portion of the neuron, which are essentially like the cables that connect inside our brain. And we have a term here called diffuse axonal injury. And for secondary level damages that could happen after a while, so that could include inflammation, tissue loss, as seen as this CT scan here. There could be continuous neurons injury, cell death, and there could also be changes to our blood vessel network, which might affect the pressure inside the brain. And so swelling might also happen alongside with other neurochemical changes. Okay, so what happens to us cognitively then after we know what has happened biologically? I always describe our cognitive reserve to my clients as like the gas tank. So like our brain power, gas is very precious nowadays since it's so pricey, and so is our brain power. Pre-injury, we might have been running on a full tank here. And post-injury, we might be running on maybe like a half tank or even a quarter tank to finish our daily tasks. So another way to also understand it is in the form of an energy pie, like a pizza pie. So if you look at the left side, this is the pre-injury picture where our brain hypothetically stores half of its capacity with reserve and fuel, the purple side, and then it's spending 50% of its capacity processing emotional, physical, and cognitive demands. So that would be the blue, red, and the green portions here. So you can see that our reserve is adequate and sufficient to handle the needs on the right side. Now, if we look at the second picture here, this is a post-injury picture. Our reserves reduce in portion due to the biological and physical changes inside the brain. And unfortunately, our demands at the same time also increase. So for example, there may be potential changes to our employment or our jobs during sick leave. There might be financial disruptions or concerns there. There might be increased stress surrounding changes in our environment and the way we also kind of look at our own abilities as well. So you see that our reserve here may not be sufficient enough to address all these other demands, and it often might lead to feelings of, very overwhelmed. So my clients do find this energy pie very helpful in understanding why rehab is very important. In our COG rehab work together, we acknowledge the importance of banking brain resources after an injury and also to use cognitive strategies wisely to cope with the demands of the external world. All right, so this brings me to talk about what cognitive rehab really is. It is essentially a collection of a wide range of evidence-based interventions that are designed to improve cognitive functioning in brain injured or cognitive impaired individuals. The goal is to either, or actually both, to restore normal functioning and or to compensate for cognitive deficits. What does the process look like? So the process of cognitive rehabilitation is like developing a toolbox for our brain. We want to gather strategies in the toolbox. We want to get to know our own toolbox through finding out what inefficiencies we have and what the tools would look like. For example, which tools might work best for us so we can keep them for future use. It is important to work with your individual therapist to come up with a very individualized plan. Great. All right, so we do recommend folks to always undergo a neuropsych evaluation before going for cognitive rehab. It usually takes about like 2 to 3 hours to complete a comprehensive assessment. But the results are very helpful to help your therapist identify your cognitive strengths and weaknesses, as well as your emotional well-being. And we're going to use that data to inform treatment planning. So what are some of the domains that we look at? So some of the cognitive domains that are mainly covered in the assessment would include attention, processing speed or thinking speed, memory, executive functions. These are seen as complex thinking skills such as decision-making, planning, mental flexibility and problem solving. We also look at visual spatial skills, language skills that might include both expression and our language comprehension ability. And of course, last but not least, our mood functioning. So you might get screened for any depression, anxiety, or PTSD symptoms if trauma was involved. And in our presentation, or actually in our webinar, we are focusing on these 4 domains in this current presentation and the upcoming ones, because these are the more commonly presented cognitive complaints in our clinical experience. All right, so let's shift gears right now, and we'll try to do like a simple poll activity. We do want to get a sense from the audience tonight to see what cognitive difficulties have you noticed after the injury. It could be an injury that you experienced yourself, or if you're a caregiver or a clinician, you can indicate what types of difficulties you have seen or encountered in someone that you're working with or have worked with. So I'm seeing a lot of responses here. Let's see. Do we have almost everybody? Just a few more seconds.
We've got 70% participation. And we're almost at a minute.
Yeah.
Okay.
All right, yeah. All right, so we look at the results together. All right, so just using, so we have a small n, but if we were to look at the data, so the majority of us, do have some experience, either experiencing or working with memory and neurofatigue. So great, we'll be talking about that in our next session. And attention and processing speed is almost like half of the group as well. So that actually is our focus of tonight. So thank you guys for participating. Great. Okay. All right, so let's move on. All right, so let's talk about attention here. So we have a brain and also a screen. So pretty much like what we are experiencing right now. Okay, so what is attention? Okay, if we think of our thinking skills as like a pyramid, attention probably lies near the base of that pyramid. It is a very important cognitive skill that is the foundation for memory, as well as other complex abilities like problem solving or decision making, because we have to register and attend to the information first before we can manipulate them in our heads. So these blue bubbles here, they kind of reflect some of the description of what attentional difficulties may look like. So for example, people may say, oh, well, my mind starts to wander, and when I'm reading, I have to reread the same sentence many times. In social settings, I feel lost in conversations. At work, I am easily distracted. Or there could sometimes be a feeling that my head is always in the clouds. So I guess at this point, I also want to invite Dr. Adams to share with us what emotional or internal reactions one may have when experiencing attention difficulties.
Yeah, thank you. Well, as the slide notes, it's an important foundational piece before you can actually experience memory, have memory, is attending to something. So as Dr. Choi said, if your mind is wandering while you're reading, or you find yourself rereading sentences, you're likely struggling to attend to them and really take them in. So some of the emotional responses that can surface or arise in these encounters in your own mind, you may feel a little more disconnected from conversation with someone. If you feel lost in the conversation, you may feel frustrated more easily, confused. And when you're easily distracted, again, not feeling connected to a person in conversation directly or to the material you're taking in. Often the emotional responses that arise from that, especially if you never had any challenges with your attention or reading a sentence over or your mind wandering, may lean a little negative. So you may feel anxious about the permanency of this state. You may start to feel like, oh my God, this is from my injury. This will never change. Or in the case of a caregiver, oh my God, my friend, client, partner may never return to what they once did. So anxiety can rise. We can judge ourselves based on skills we once had, and have an impatience arise. We can judge others if we feel as if the person unwittingly is unable to keep up with the conversation, but once did, and they're not able to say, this is part of my injury, or this is a reflection of the healing. And so judgment from others may weigh on you, thinking, oh, they're not thinking I'm listening, or they're concerned that this will remain. So really just noting kind of these secondary reactions. One thing that can be useful is being able to name what's coming up for you. If you can say, I'm sorry, can you repeat that? Or I need a little more time. Even to yourself, trusting that this can be a healing process, which takes varied amounts of time depending on the injury and your kind of pre-functioning before the injury. So those are some of the emotions that can come up surrounding your ability to attend to what's before you, and knowing that during an injury and the process of recovery, that we just need to be a little bit more intentional, where these are things we perhaps always felt were quite automated prior to the injury.
Yeah, well, thank you, Dr. Adams. And I think that speaks very well to our approach to doing cognitive rehab, is that we not only address the cognitive piece, but we also pay attention to a lot of the psychological effects that come with the brain injury itself. And so at this point, I kind of also want to introduce different types of attention here. We can feel confused at, as what Dr. Adams has shared, when we don't know sometimes what is happening. So in treatment, we always try to break down the different types of attention to kind of help us know exactly what we are struggling with. So this diagram presents attention from the basic level to more complex attention levels. So at the top here in this gray box, focused attention means the ability to focus one's attention on something. So for example, right now, while we're attending the webinar, like, are we looking at the computer screen, right? Or is our mind like somewhere like wandering what to have for dinner or what to have for lunch with my colleague tomorrow? So that's one example of focused attention. Sustained attention is the ability to pay attention for a long time. So for example, am I still focused when I'm like 20 minutes into this webinar today? Do I notice my mind drifting away after 10 minutes? Selective attention is the ability to ignore distractions. So for example, while you're listening to this webinar, if there's construction work happening outside your place, if your neighbor is like frying a delicious steak next door, those might be distractors, right? And so it's about our ability, this filter inside our brain, on whether we're able to ignore those distractions and focus. Alternating attention is to switch attention from one thing to another. So it's like making a dish. So like, for example, you're making a pasta dish. I'm boiling water, like the stove. I'm also cutting up ingredients. I have to shift to go back to the fridge to take my food out. And then I have to go back to the stove to, strain the pasta and stuff like that. So that would be using our alternating attention. And lastly, divided attention is a little bit tricky here. So sometimes people call it multitasking, like doing more than two things at a time. We think though, in reality, it's more of like a rapid form of alternating attention. And it's interesting because a lot of people would notice that they find it especially more difficult to multitask after having a brain injury. And one of the things that you might, an internal reaction is that you may notice that some of these attention processes are very automated. But then when we kind of appreciate this in the context of brain injury, sometimes depending on the impact of the injury on the brain, some abilities could be more impacted and they can present as a greater difficulty than other levels of abilities. We also have questions like, where is attention exactly located in the brain? So a short, sweet answer to that is there are so many parts of the brain that are involved in attention. So as you can see, the blue patches, the purple patches here, the regions are really distributed across so many different lobes in the brain. So they could be across the frontal lobes here. It can stretch all the way to the parietal cortex, which coordinates our sensory information. It might also involve our striatum, which is part of the subcortical area in the brain that controls our reward pathways. We want to highlight that these different brain regions, they actually work together. Well, first of all, they manage different types of attention, and they work together to help us respond to and also stay focused on the important aspects of the situation. And so injury or damage to any part of the brain can cause changes in attention. And of course, different conditions can also affect our attention in different ways. Now let's talk about strategies. So in cognitive rehab, we classify strategies into two types. We have external strategies that are targeted at modifying our external environment. We also have internal strategies where they're targeted at acquiring compensatory strategies that our brain can adopt and use in certain situations. All right. So in cog rehab, we always encourage our clients to practice note-taking so that we can help ourselves encode the information better, and also to have a platform, to have a way to access the information later after the session. So some note-taking strategies will be shared in more detail in our next webinar on memory. But at this time, if you want to practice the skill, we want to invite you to take out a notepad. So when we go over some external strategies for attention in the next slide, feel free to jot down 3 or however many that you feel could be helpful to improve your attention. All right, so let's take a look at these external strategies. So number 1, ask for cues. So in cog rehab, we believe awareness is the first key step to recovery. Sometimes we might be aware of attention difficulties, sometimes not. It's always helpful to ask a loved one or someone you trust to cue you. It could be a private signal, like just tapping you on the shoulder, and that can over time help you increase awareness to the situation and prompt you to take breaks. Number 2, ask people to slow down or repeat information when you're feeling overloaded. So when working with clients, we're aware that it may be uncomfortable sometimes to ask for repetition. So one good way we suggest is to actually paraphrase what we heard and ask for confirmation. So for example, I'm understanding that you meant A, B, C. Is that correct? Or another way could be, well, I remember you mentioned X, Y, Z, just wanting to check in and to be sure, and just let me see if I got this right. We want to also develop a habit to get organized and create a clutter-free workstation at home or at the office. So to practice what I preach, I took the time to reorganize my messy makeup desk. So on the right was my messy desk. And then on the right, after reorganization, it looks kind of less messy, but I did make use of the compartments of a tray to organize different items categories. So I have my brushes on one side, my eye products on the other side, my foundation on the next side. So it is by no means a Marie Kondo level of organization, but we do find that compartmentalizing items categorization does help me grab the things I need quicker. Another strategy I found helpful in this experience is to have a habit of throwing away trash and unnecessary things, so we can minimize distraction as well. I also want to talk about creating a system and a calendar using colors and visuals to highlight information, and also to use different ways to minimize noise and other distractions. So I have an example here. Okay. So some of you may be using a smartphone calendar function, and the good thing is we can actually use different colors to categorize different tasks. So blue might be personal appointments like my Pilates class and calling a friend. Purple will be my work meetings, and then orange colors are the family related appointments. We also have an example of using a physical calendar here. You see the person wrote the word appointment. We just actually encourage you to note down the 5 W's for appointments to avoid confusion. So for example, if I'm attending an appointment, I actually want to note down on the calendar who the doctor is, what specialty they belong to, where is that clinic, what time is the appointment, and to make a mental note of why this is important so it sticks. To minimize distraction, we encourage investing in a good device that filters out distraction. Some of my clients love using noise cancellation headphones. If you live with someone, with other people, or your workplace is noisy just by nature, it could involve some negotiation along the way with other people to try to come up with ways to create a quiet space for yourself. All right, so lots of strategies there. I'm going to take a pause and just take some time to digest the strategies. We have another poll activity here. Just want to see if you want to participate and select the strategies that might seem relevant and helpful for you. All right. Excellent. We're hitting 100% participation here. And it does look like the minimization of noise and distractions is a popular one for the group. All right. Well, thank you for indicating that, guys. Thank you. All right. Okay. All right. So now we're going to bring out our notepads again. And whoops, I'm going to move on to the next 2 slides to talk about internal strategies. So remember, internal strategies are frameworks and skills we form inside our mind. So just listening to them is not enough. We need to practice and practice. Okay, so as mentioned earlier, the awareness of one's limit is always the key to good rehabilitation. You may want to notice how and when the difficulties arise. So for example, what factors make it harder to concentrate? So these could be internal factors like feeling tired after work or having an argument with my partner. It could be external, where I could have, went to a very crowded shopping mall. I was stuck in traffic for a long time and just, feeling tired and not having that ability to focus as well. And then next is prioritizing activity. So banking your energy. Ask yourself what time of the day you feel most energetic. Am I a morning bird or a night owl? Tasks that are more difficult, we encourage you to do them, to get them done earlier in the day or when you're not or less tired. Be intentional in taking breaks. So we want to schedule regular breaks, for example, 15 minutes for every 30 minutes of sustained effort. The brain is a very interesting organ. It doesn't really have pain receptors. So unlike our bicep muscles, like after lifting, weights for 10 minutes, we feel sore and we want to take a break. The brain doesn't really have that ability to know when it's hurting. So in order to take care of our brains, we want to intentionally insert break times. More detail about pacing will also be shared in our 3rd webinar. And number 4, gradually increasing the amount of time you are working on the task. So some clients share that at the beginning of their rehab process, their sustained attention span was very short, say only 5 minutes. And so in our rehab process, we make a structured timetable to kind of gradually increase our active brain times. So the brain will learn to tolerate longer periods of attention over time. It's kind of like building up that stamina for the brain. We want to talk to ourselves Verbalization of instructions is always helpful to help us stay focused. We can change the way that you're working. So if you're sitting, you can stand up or walk around the room, disengage from the task and come back for better refocusing. And here are some also helpful reminders when you notice that our attention is slipping away. So a good one is to remind ourselves to slow down and don't rush. Based on our understanding of how attention works from a biology point of view, we know that we can only focus on one thing at a time, right? So we can remind ourselves to do that. And some people like to print it out on a beautiful wall art. You can do that as well. And we want to, develop a habit as well to double check our work to minimize mistakes that might have come up due to attentional inefficiencies. And then lastly, we want to allow our brain to train, but also to rest. So we want to notice our sleeping patterns. We want to exercise regularly. But of course, if there is mobility issues involved, we want to work that with our physical therapist. We want to engage in leisure activities. So it's basically talking about intentionally carving out time to massage the brain and let it relax as well. All right, so time for another vote. So let's pick some of the internal strategies that might be most relevant and helpful for you. Something you can try this week. All right, I'm looking at 90%, 100% participation. All right, we have a very engaging crowd tonight. All right, it looks like developing awareness and also banking your energy. Yeah, those are the more popular one among the crowd. And if I were to reflect on my own clinical experience, I would say those are the top common ones that my clients like to pick to use as well. So thank you for participating. All right, so let's shift gears again. And now let's talk about another cognitive domain, and that is processing speed. So what is processing speed? Sometimes we use another term like thinking speed kind of interchangeably. Essentially, it is referring to how long it takes someone to do a mental task. So just imagine your brain has a speedometer on it, right? From a biological perspective, the second picture here, our brain neurons are like cables and they're insulated by fatty tissues called myelin sheath. So the better the insulation, the faster the conduction rate. However, in the context of brain injuries, because there was twisting and shearing of our axons, some myelin sheath may have been damaged. And so the signal firing is not as efficient, resulting in slowed processing speed. This is sometimes visualized as white matter hyperintensities on neuroimaging scans for those who've had that in their records as well. Sometimes they're just not visible on any scans. After a brain injury, it is common to experience information overload. So what that means is our brain actively, actually every second, receives incoming information and it processes outgoing information as well. So we have some examples here. One example of slowed outgoing processing speed could be this blue bubble here, where it says it takes me a longer time to structure a sentence or to write things out. Some examples of slowed incoming speed could be feeling that I'm not receiving 100% of the information sent to me. So there might be trouble keeping up with conversations, There might be information not sinking in. So it's really difficult to follow the plots while we watch a TV show or a movie sometimes. And we might also find that it's hard to plan for activities. So there might be delays in arriving at appointments. So at this time, I also want to invite Dr. Adams to kind of share some emotional reactions that might arise when one experiences slow processing speed on a daily basis.
Yeah, thank you. Not unlike the challenge of attention. And if we feel it's shifted or different than it originally was for us, the idea of naming it to tame it. So noticing, if you've heard that phrase, when we name it, we can kind of tame some sense of overwhelm. So the idea of experiencing this secondary emotion. So we can't in the immediate change our slow processing speed due to an injury, but we can pause and change our reaction or judgment to ourselves by way of making a little more room to appreciate what's happened, naming what's happening for us. Back to, can you slow down, requesting that of other people, even asking yourself, right, for a bit more patience there, pausing and noting, I'm becoming frustrated. I need to slow down here to take in this information or change my way of going about this. So connecting for help, reaching out, if it's something that, you're at an appointment and you're late, but you made it and you're a bit frazzled, or as a caregiver you are, noticing that, pausing and slowing down that you're there, seeing if there's anything in the immediate you can do to tend to yourself so that you can carry on with the appointment or the conversation or the TV show. But the idea is essentially cultivating awareness around what's happening for you, pausing, seeking help if you need that, and trying to remove that secondary judgment, trying to remove the labels or the more fear-based anxiety that may crop up when you encounter the slow processing speed due to an acquired injury of the brain.
Thank you, Dr. Adams. Yeah. And yes, so we definitely want to give ourselves more time to do the task. And I just spotted there's a comment saying the slide hasn't changed. So Dr. Kraft, just want to make sure, am I on the right slide right now? If I change this to the next one?
Mm-hmm. Yeah,
Okay.
I believe
All
so.
right. Okay. All right. So just to make sure, and I'll address the other questions that I see in the chat as well later. All right. Okay. Yeah. So to address slowed processing speed, we are basically using the concept of time in our strategy, and we call it time pressure management. The key message here is to actualize the statement. So let me give myself enough time to do the task. So, all right, so we have 4 steps in time pressure management. So firstly, we want to analyze the task for time pressure. We want to ask, are there any pain moments that would call for a high time pressure? We have 2 examples tonight that we can share what exactly that would look like. So bear with me as I go through the steps. The second step would be identify what useful decisions or actions can be made in advance. So we want to identify things that we can do ahead of time. Third, step number 3, it's always good to have an emergency plan. So in psychology, we know that increasing predictability of a situation can reduce anxiety. So we want to do that for our brain health as well. We want to consider potential problems that might arise. We want to develop a plan to deal with unexpected situations. And lastly, after we complete the task, whether it went smooth or it went bad, it's always good to monitor our performance. So for example, we can ask ourselves, did it go well? Did my emergency plan work well? Were there any kind of high time pressure gaps that I might have missed that I want to account for next time? So some of us may think, this is so obvious, like we tend to do this all the time or anyway. And it is true that sometimes for more well-rehearsed tasks or routines, this can already be implicitly done. However, in the context of brain injury, when attention and processing speed may be less efficient than before, we might also need to be a little bit more intentional and more explicit in planning out things in order to reduce errors or delays. And it is the goal that over time during cog rehab, we can internalize these steps to kind of develop a habit of thinking in advance to kind of compensate for the slowed speed. So as promised, we have an example here. So to start with, we want to start with this example to kind of talk through the steps of applying time pressure management. And one of them is preparing for a Thanksgiving dinner, where we will prepare a pumpkin pie together. So I'd like to invite Dr. Adams to kind of help talk through these steps with us.
Yeah. So in this example, analyzing the task for time pressure, we have a timeline, a date. So we're noticing when we need this pie by. And so under analyzing it, we'd want to make sure that we've prepped by shopping for ingredients. We want to know how long it takes to put those together and bake a pie and create a bit of a timeline. Then we move on to what could be useful, identifying decisions or actions, anything in advance. One of the biggest pieces is creating a bit of a buffer. So the idea that if this has to be done at a specific time, in this instance, in this example, perhaps giving ourselves an extra day or two, since none of the ingredients tend to be perishable, an extra day or two as a buffer. So perhaps prepping by going to the store, identifying the recipe ingredients in advance, making certain we have a list, bringing the list, and again, going days before in the event that we need more time or something goes awry. So if, for example, our ride to the store falls through and we're not able to make it that day, or we end up being tired, fatigued, sick that day, having a bit more of a buffer allows us to trust we can still meet the demand or get the task done. And then adding in, of course, the prep work, how long that will take you to set these pieces aside, organize them, and then actually baking them. Moving on to an emergency plan or plan B, what are your options? Is there a different dish that you feel comfortable piecing together, whipping up if the pie falls through or there's an ingredient missing? Is there something you can buy ready-made that allows you to feel like you already have a backup plan in the event something does go awry? And lastly, at the tail end here, returning to monitor your performance. And by that, it's not just did you meet the task, but was it pleasurable? Were there any areas, in which you could have done this differently, where you can reduce your stress in the future? Is there anything you could have done sooner? Is there anything that you'd like to leave to someone else in the coming year? Are you done with baking? The idea of monitoring your performance and how it went, and if there's anything you'd like to change.
Yeah, thank you. And of course, we learned how to apply time pressure management for Thanksgiving. Now, we can also apply the strategy on smaller things as well. So for example, a common one that we often discuss with clients will be like how to be on time to appointments. So our next example is to prepare to attend a doctor's appointment tomorrow. So Dr. Adams, if you want to take
it. And so the idea of a doctor's appointment, unfortunately, it will likely not be the last. So you'll have a handful of appointments in the future. So if you have an appointment the coming day, you want to analyze attending on time and really all of the precursors to getting ready to be able to leave. Is this a morning appointment? Will you have time to get dressed? Do you need to have breakfast before? Assessing your commute, how long it will take. Do you have a ride to take you? Is someone going to drop you off so you don't have to manage parking? Is there a lengthy process at check-in with COVID or post-COVID era? So really just kind of assessing all the pieces that once perhaps seemed firsthand and easy as you prepare for the appointment. Moving on to identifying what decisions can be made in advance. So again, back to those fine point details that may take twice as long due to this injury. Would you pick out your outfit the day before? Do you need to map out alternate ways to the hospital in the event there's traffic? Do you have your medical cards and photo ID prepared? A mask. Is there anything else that would be useful to you surrounding the day? Bringing snacks, making sure you have water. And then again, moving on to that emergency plan. If something arises, can you reschedule? Is there someone you would need to call? If your ride doesn't come through, are you familiar with hiring a taxi or an Uber on your phone? Letting the clinic know if you're a bit behind so that you can actually still make the appointment you had put in place without having to cancel it if you are delayed. And again, returning to monitor your performance, back to that patience piece, offering yourself or your client a bit of kind of graciousness around reflecting on what went well and what didn't. Is there anything you would do differently next time? Can be helpful to note your progress in attending to how you organize and manage your time and appointments that are of importance.
Thank you, Dr. Adams. Yeah, and indeed, like during our work with our clients, like we do want to pick out, certain tasks or activities that seem to be the most kind of stressful for them on a daily basis. And we try to like work through each step with them. So it's very customized, very individualized. But here we just provide the general framework. And like before, some folks might also have different reactions when they go through different steps, when they work through time pressure management as well. And so in therapy, we like our role is also to kind of address that as we learn to pick up certain strategies. So at this time, again, we want to allow time for us to digest the information that that was just presented to us. So we have a very short reflection time. I'd like to invite folks to identify 1 to 2 tasks in the coming week that you feel can apply and practice time pressure management. And remember, the key thing or the key statement is allow myself to give myself enough time to do that task. So maybe we'll do like a 30-second kind of reflection here. And then if there's any questions about using this particular technique, you're also welcome to type that in the chat box. All right, so I can't see everybody's responses, but I'm assuming we've given you some time to kind of reflect and digest the materials. So with that, we want to kind of wrap up the content here and give the group a general kind of preview of what's going to be discussed next Tuesday. So next time we will be talking about managing mental and neuro fatigue, which was one of the top difficulties that were that the group indicated their interest in earlier. We're also going to talk about how memory works from a cognitive psych standpoint. We're going to share the model of memory. We're going to kind of break it apart and kind of tease out how memory difficulties can arise when certain processes were disrupted in the context of brain injury. And then, of course, we will also share different strategies for memory deficits. And with that, I actually do want to transition to